Welcome to The Sterile Room. This is a podcast geared toward all general surgery residents to discuss a myriad of topics ranging from choosing a fellowship, performing a COCA maneuver, and to managing one's expectations during a grueling 5 years of residency. The goal of this podcast is to provide listeners with another line of education, but also, and more importantly, to discuss topics that are deemed taboo and hopefully sterilizing them. Thank you for tuning in. Hey guys, welcome to the Sterile Room. Paul, and happy to be accompanied by my other residents here. We have Will, who's a categorical PGY1, and then we have Nick, who's one of our PGY2s. Joining me here today because we're going to discuss a day in the life of a surgery resident. And this may not be helpful, or it may be, to other residents, but more so for those that are not. Maybe your spouse, your loved one, your boyfriend, your girlfriend, your friends, your family, that really don't understand how much work you put into, on a day-to-day basis just to be a surgery resident. This is going to be more so of a podcast series where I'm going to start obviously with our more junior residents today and then eventually move on to our chiefs and maybe some attendings and fellows. All right, well, we'll jump in. First question. I'll start with you, Will. What time do you wake up?
Listen, Paul, I am not a morning person in the slightest. The expectation is that everyone on service arrives at 5 a.m. I live about 10 minutes away from the hospital. Alarm goes off 4:32.
4:32, nice. That's very specific.
Yes.
All right. What about you, Nick?
Well, I can say that when I was an intern, I was getting, and I used to hate when attendings say that. Well, when I was an intern. But anyway, so when I was an intern, I was probably getting up around 3 o'clock every morning. Didn't have to be at the hospital until about 6.
Wow.
But I like to try and wake up, and I'm a slow morning person. I like mornings, but I like to ease into it. But still today, I wake up somewhere around 3:45, take my shower, have my slow cup of coffee, play with my dog, and then I get to the hospital sometime, maybe a little bit before Will over here, sometime around 4:40 or so. One of our chief residents likes to get to the hospital around, 4:15, so it makes me want to go a little earlier.
Right. What time does your dog wake up?
My dog, actually, surprisingly enough, he is not a morning dog person. Yeah. He's not a morning person, so...
they're people, don't worry.
Yeah, exactly. So he meanders on downstairs and makes sure he goes to the bathroom, and then he goes back inside and sleeps. Yeah, it's a tough life.
Very nice, very nice. Well, you kind of went into the next question. I wanted to know if you guys have any, morning routines that you normally do. Nick kind of touched on it. He likes to do a nice cold shower there, enjoy his cup of joe, and then play with his dog. Will, do you have any morning routines other than just rolling out of bed and come straight to work?
Paul, I envy the people who can get up and I've heard of talking to some of my friends in other programs. They'll go to the gym, before rounding on service. I can't say that I can do that, but one of the things I do like to prioritize is I always want to grab a bite to eat before I leave the house, even if it's just something quick. So got to get something in my stomach before I head out onto the floors.
All right, what are you getting, man?
Listen, I myself have a peanut allergy, so I got to stay away from that. But You got to get your carbs, got to get your protein, and I'm a big fresh fruit guy, even in between cases. But I'm sure we'll get to that. I'm very much a snack guy throughout the day.
I'm gonna step in real quick.
Go ahead, Nick.
The correct breakfast for a surgical resident in the morning is to get a good combination of fiber, protein, and a little bit of slow digestive carbs. So, coffee, non-fat milk, limit your sugar, get you a decent amount of protein, and then you have. I'm not going to stoop for any specific brand, but protein waffles with sugar-free syrup, golden.
Sounds actually something I would eat right now. That's really good. Are you trying to get us some sponsors, man? Is that what you're trying to do?
Eventually that sounds great. I eat a lot of one in particular company's protein pancake mix, so if I wanted to throw a little bit of that my way, that'd be all right.
All right. Well, sorry, Will, I cut you off. What were you going to say?
No, not in the slightest. I envy you guys for having it figured out. Maybe it just comes with the territory. Maybe I just need a little bit more time. And
well, you are young.
It'll come together.
You'll get there eventually. So we talked about what time we really get to work. Usually it looks like 5 a.m. is sort of the set point, the barometer of where we go there. But Nick likes to get there a little bit earlier. Will, sort of just a little bit beforehand. Either way, first things in the morning, pre-charting, right? What do you guys do once you get to work? What's that routine like?
So I think the biggest thing is just to get a pulse for what in the world is going on. So what were the big events that happened last night? Go and print out the sheets, take a quick skim down the sheet, who had codes and rapids called overnight, who's going to the OR today. Just get a feel before you start diving in on your individual patients for the day. I think having a good sense of the overall stability of the service sets you up to prepare appropriately in triage, which is one of the hardest things I had to learn in my first couple months on the service.
Very nice. Nick?
I actually have to backtrack to my morning wake-up routine. One of the reasons why I wake up so early is one of the first things I do when I wake up is I pull up our charting app on my phone and I start looking at patients from home, because I as kind of in line with the fact that I like a slow morning, I like a slow burn to my my get to the hospital. So I like to kind of know what's going on so that I don't feel rushed, and I kind of have a global sense of what happened overnight. So and I feel like that's something I will continue to do. Maybe that makes my mornings a little worse, but it makes the day, I feel like, kind of ease into a little bit slower.
No, I agree. I actually still do the same thing as a 3 and even as a 1. I was doing that. Pretty good stuff so far, guys. Thank you. Let's kind of move on here. I guess each of this question will be obviously different for each one of you, but what are your core responsibilities when you're on the general surgery or trauma service? Will?
So I think my biggest responsibility as a whole is, I had someone tell me this when I was in medical school. It's just make the person above you look better. So what I can do in terms of my actual set responsibilities, one of the biggest things is to make sure all of the patients, like I said, I went through what happened overnight, what were the major events, what are the lab values, just getting everything kind of triaged appropriately so that I can, have something of substance for my senior residents.
Yeah. And then are you saying majority of your responsibility is more on the floor per se and just managing patients, surgical patients, seeing consults, etc.?
Certainly. I think I haven't completed my first year yet, but I think the expectation going in and continuing on to this point, I kind of understand. Step 1 is know your patients. If you know your patients, everything else flows from there. It's better for you, it's better for everyone on your team, and of course, ultimately, you are the advocate for that patient because you're the boots on the ground, so to speak, which is kind of how I see myself in my first year position.
Nick?
So I'll second what Will said. I think when you're a junior resident, your job is to try and make your seniors look good. But I think the caveat being when you go from being a 1 to being a 2, and I'm sure every year thereafter, your roles and responsibilities, you don't really lose anything that you had the year before. You add some. So, in my opinion, or for me, my responsibilities are to know all of my patients, but to also know what the interns on the service are doing for the day, kind of make sure that they have their responsibilities and, their tasks lined out. I also will have mine be on the floor. As a 2, I try to get into the operating room as much as I can, maybe not as much as I may like to, but it's finding that fine balance between, delegating, doing your own floor work, and then also trying to get into the operating room. And one thing that my co-resident over here, Paul, said once, several months ago, that I tend to agree with is, and as you move through your year, you should really try and act like the year ahead of you. Really push yourself to start taking on more responsibility. And I'm somebody that has a lot of, maybe I'm a little too hard on myself, but I think coming into work and trying to figure out what I can do better today really sets the stage for every work day.
Solid answer, gentlemen. Solid answers. Very good. This is more of a funny question, but I got this asked by one of my friends. How many steps do you make a day on average? I was looking at mine the other day, especially if I'm on a 24-hour call. I'll be somewhere up to 15,000 steps in that 24-hour period, average about 8 to 9 to 10 on a given day. How many steps are you averaging, Will? Have you looked at that yet?
You've got me beat, Paul. So I originally was wearing a certain wearable fitness device when I first started on the floor so that I could get the pages and the messages a little bit more efficiently.
Sure.
I never topped out over 11,000, so maybe I need to be walking around the hospital a little bit more.
So if we're talking general surgery or trauma,
Yeah.
if you're not on a 24-hour call, typically hitting around 12 to 13,000 steps. 24-hour call, I'm typically much more than that. I'm also somebody who is unable to sit still, or I'll fall asleep on call nights. So that probably contributes to why I have more steps than the average person. Although Paul's shorter than me, so he has smaller legs.
Height difference,
more
longer
steps.
strides.
So just throwing that out there.
Exactly.
Come on, guys. That's why I'm doing this on the podcast. I want anyone to know I'm short. Anyhow, yeah, no, I agree with you, man. I think walking, I have to be doing something, especially on 24 hours, so I'll get tired. I think a lot of those steps, not only to the ER and the OR and consults on the floor, but also to the doctor's lounge for coffee. So that's another tip if you guys want to boost your numbers. Gosh, this is a funny one to ask, but free time, do you guys have it? And if so, what do you do?
Absolutely. Again, I would argue that my hobbies are probably not akin to that of some of my other surgical residents, but my two biggest hobbies, I would say, are probably traveling. So anytime I have that wonderful golden weekend, I will take off to a new city, and doing my residency in a place very, very different from where I grew up. I wanted to get exposed to some different places. And the other thing was, right at the end of medical school, I went and got myself my pilot's license. So I've been trying to get up in the air as much as possible. So
It's pretty rad. Nick?
So free time comes at a premium in residency. I feel like it's certain, for whatever reason, I feel like I have more this year. Either that, or I've just become better at compartmentalizing and utilizing it better. I've got a dog. He takes up a decent amount of time. I go to the gym typically every night when I can. That's another way that I stay sane. And then that's kind of it. I also love The Big Bang Theory. That's like my decompress show. I love it. I've probably seen it at least 20 times all the way through, and I'm not kidding. But I think finding the one thing to kind of level you out in the crazy job that we have, and it's easy to get kind of a little bit bitter and jaded with all the things that we see. And I know nobody really likes to talk about just the humane aspect of things, but that's really important to have.
I agree. Kind of going along the same vein, I guess, if you have free time, are any of you guys in relationships? And if so, how are you balancing that with residency?
certainly, and I'm personally in a long distance relationship, so having that conversation before started residency and understanding that setting aside time for each other and budgeting that time, everyone has finite amounts of free time. It's all in how you spend it.
Mm-hmm.
So as long as you set clear expectations moving, at the beginning and moving forward, and you're flexible to each other's schedules and the individual stressors in our lives, I think, it's made for some challenges, but I think overall it's been a great experience. Wouldn't trade it for anything.
Nick?
Well, I think I was one of those residency casualties. I had a relationship for my entire intern year and the first couple months of my second year, and I think because of the nature of where my mindset was, the job, and that relationship ended, but it's actually been a good thing. Residency's hard, and if you aren't quite, able to be happy with yourself, it's going to be really hard to be happy with somebody else. And I think having the time to really focus on myself, on work, and kind of just becoming the best version of myself I can. Short answer is no. No, I'm not. But I think this year has been a solid year of getting over that, and kind of maybe the next one that comes around will be Miss Right. But for the time being, just enjoying my co-residents. We got a great group.
Just to let everyone know, this is not a dating app for Nick, but he is available, as you've already heard. I started dating my fiance back in med school, and I kind of had that discussion with her early on when I was, going into deciding what specialty I wanted to go into. Loved general surgery, but I also knew it was going to be very rigorous and time-consuming, and a tough career to kind of balance that. And like Will was talking about, you got to set those expectations then and there, and I think that helps protect you. I know some former girlfriends of mine would have been upset at me because I just don't have enough time for them, but really it's setting expectations and then really just carving out that little bit of time. Mm-hmm. It doesn't have to be a whole week's worth. Maybe that one dinner a month. I take her out to a nice fancy restaurant, and that sometimes does it and keeps the butterflies afloat.
I'll make one more comment as far as things learned as a resident in a relationship that didn't work. I think being on the side of reflecting on some of the things that maybe, I used my job as a crutch for is, as surgical residents, we're busy, right?
Mm-hmm.
But that's not an excuse to kind of start shirking off the little things. Coming home after an 18-hour day, doing the dishes doesn't sound fun, right? Doing the things around the house with somebody that's important to you doesn't sound like the most fun thing to do, but those little things matter. And if you can take the time to do those things, it will really go a long way in your relationship.
Dr. Phil in the house. No, that's 100% true. Perfect. But yeah, I mean, and just moving along, studying. I know we just finished ABSite. I've sort of like to give myself almost 2 to 3 weeks of just decompression time afterward. But what do you guys do studying? How do you fit time in? Are you guys study before work, after work, or maybe just wait till you have golden weekend or a day off? How do you guys help supplement your studying?
Well, I'd like to pretend that I threw it into high gear from July 1st in my intern year. Obviously, that was not the case. Deer in headlights to start. But all that being said, I started ramping things up last couple months leading into the winter season. But I took the mentality: if it ain't broke, don't fix it, or whatever they say. And I kind of used the same strategies that I used for studying for my medical boards. I mean, unfortunately, these kinds of things aren't going to leave us. Mm-hmm. We have this to deal with for the rest of our life. Yeah. But knowing that it was a different testing format, knowing that entirely different subject material from what you're used to, I think would be to refer to the upper year residents. They've been through it, they've done it before. You have some guidance on what worked for them, what didn't. Obviously, you can fall into a trap and go down the other line, but kind of synthesizing what has worked for everyone else really made a difference.
So do you study in the mornings, afternoon?
The crux of our question.
Fair enough. No, as I mentioned before, I will go on record saying I'm not a morning person. Nothing productive will happen until I show up at the hospital. I would much rather stay up late. And normally for me, it's an after dinner deal. I take the time between getting off work and dinner to just take that time to myself. So I will not touch a book until after dinner most nights.
We are on the very far ends of that spectrum because I am a morning studier. Typically, during the ABSite season or leading up to, I wake up an extra 30 to 45 minutes before. I'm a big proponent of studying when you can, as much as you can, and as often as you can. So I will wake up in the morning, and this is one addition to my morning routine, is I'm drinking my coffee, I'm doing practice questions. On the way to work, I'm listening to study podcasts. If I'm between cases and not doing notes or seeing patients, I'm doing practice questions. And that's just something that I found that worked for me starting my third year of medical school. I was doing questions when you can, how you can. Having phone apps for questions has been a godsend for me. Because as I said earlier, I don't sit still very well. Sometimes I'll study at night, but it's typically it's a morning thing throughout the day. If I have a golden weekend, it's still I'm going to wake up a little bit early and I'm going to study in the morning, and then about 12 o'clock or so, I'm done. I'm going to go mow my yard or play with my dog or go to the gym or go meet Will out for a
couple adult beverages, if you will.
Wait, you guys drink?
No.
Some of us aren't 21 here.
That's true. Yeah. Oh God, Dookie Howser in the house. Really, dude, what kind of literature, what are you using to supplement? I heard some question banks. What books, if you use books, ebooks, or anything that you guys use to help supplement your studying regimen?
I'm an old school Sabacens guy. I have not deviated from that, although my recent...
over there.
Do you have one?
Of course I do.
It's floating around over there somewhere, I'm sure. But
getting dust.
Yes, I have not deviated from that. However, I have been persuaded by some of my peers, perhaps, that I should look in other directions. So we'll see as we kind of come to the end of first year here and really need to work on expanding my operative knowledge. What ends up coming my way.
So I was not a textbook reader my intern year. I tried with the Sabacens. It's just not something I liked. I read Greenfield a little bit, but I'll be honest, I did mostly practice questions and review podcasts and review books. One boon that I found my second year was reading targeted sections in Cameron's, especially on a couple of topics that I didn't feel as comfortable with, such as complex liver pathology, hepatobiliary pathology, and anorectal. Reading those made a lot of difference. not just for ABSITE, but the overall knowledge base. And I think I'll continue to do so moving forward. I'm really going to try and get through a textbook a year. That's the cliche. You should try to get through a textbook every single year of residency. I don't think reading it cover to cover from page 1 to page 3,000 is the most efficient way to do it. So that's not how I'm going to do it.
No, that's agree with Nick. It's sort of been my study regimen. I'm after work type of guy too, like Will. I really don't do much in the morning. But yeah, I come back, decompress, shower, read for an hour, then I eat, then I go to sleep usually. Cameron's, I think, is the next step up. Sabison, sure, I think that's good for getting that fundamental and baseline knowledge. It is very dense, heavy microbiology, which will get you some questions on ABSITE for sure. Cameron's, I think, was big one for me second year and even now. And just like Nick was saying, when I was on night float, sometimes if there was a certain pathology that I wasn't familiar with, I'd bust that book open, read the chapter on it. And that's sort of how you direct your studying as you go through your clinical presentations too. So it helps twofold. But yeah, and I'm just doing a buttload of questions from SCORE. So quite a lot. How many questions just curious, how many questions did you guys do this year before ABSITE? If you can roughly.
We'll say $1.02. I didn't want to overwhelm myself, so I tried to budget. Should I have started earlier? Absolutely, but I think the $1.02 worked for now.
$1.02.
So last year I did about 1,500 to 1,600, and I did pretty well. And this year I thought the answer was to do a heck of a lot more. So I did about 5,000, and nice. I will say that was too much. I think overdid it a little bit. And I think I'll be making some adjustments. Still did decent this year, but I think having resource overload also plays a part in how you perform on the exam. I think finding one solid question bank and maybe augmenting a little bit is probably a better approach than finishing 2 and then going back through those 2 again.
Yeah, I've been doing less and less each year. So first year probably I went through it, SCORE probably twice, so that's almost 5,000 to 6,000, and then last year around 4, this year 3. I still have to see my test scores, but I've been on an upward trajectory, so we'll see. Over time, you start realizing the pattern. Moving along, next thing I want to talk about is general surgery. I think is unique and awesome, and why I like it is not only do you have to be great with your mind, but you have to be great physically with your hands and be able to do certain things with hand-eye coordination. I did athletics before, and I think these two guys have as well, and I think that sort of plays into our hand, pun intended. But what do you guys do to help build on your surgical skills? Because obviously, from med school, you're not going to be as good as Dr. DeBakey. So, how are you supplementing not only your knowledge, medical knowledge and surgical knowledge, but also your surgical skills?
Certainly, I think some of the biggest resources I've found have just kind of been floating out there with videos on the internet, but really just spending some time on in our sim facility. Just the camera looks, when you're just holding the camera, it looks very easy and straightforward. But whenever you get the reins for the first time, and I know that'll come at different points for everyone throughout their surgical journey. But the first time you get the reins, fumbling over the instruments and trying to get your bearings under there was not a pleasant experience. So obviously the quicker that everything fell into place, I think the better. So
didn't quite answer the question, so we'll talk about hand-eye coordination. Will played hockey in college. Actually ran track.
Both.
Something
actually,
to that nature. I played football. I was a quarterback, so I'm predominantly right-handed. And I think one thing that I knew that I was going to struggle with was using my left hand. It's just always been something that's been difficult for me. So even back as far as medical school goes, I learned how to tie right-handed, and then immediately I started only tying left-handed. When I practice suturing, I try to practice left-handed more than I practice right-handed. Am I going to suture left-handed? Probably not. But it's important, kind of to the effect of what Will said about when you first get handed those reins, to project confidence. Not be overconfident, but to have some bearings as to what you're doing, so that the attending has confidence in you that you're not going to hurt the patient, because at the end of the day, that's the biggest risk, right, is hurting somebody, which none of us want to do. So I think practicing things left-handed, trying to be intentional even with washing dishes. of I'm going to grab something with my left hand and I'm going to pass it like this, and I'm going to think about how I'm going to do it before I do it. Because in a lot of times in surgery, that's important, is to anticipate your next move before you do it.
You know, Nick, you must not have had any Canadian mentors or attendings. They teach us all to start with our left hand. So
Definitely not. Definitely no Canadian mentors.
Well, I'm actually left-hand dominant, so that's
He's one of those.
yeah, one of those guys. But no, it's interesting you say that, Nick. Very, very surgeon-like answer, but I especially as an intern, I used to always hand tie both hands all the time. You never know. And then one hand tie, two hand tie. I got caught with my pants down one day with one of the attendings, like, all right, just do a random two hand tie, and I couldn't do it, and I looked like a fool. So same thing. Went home later that day, spent several hours doing it until it was second nature, and you still do that on a random, day where I'm like, yeah, I need to practice my right-handed throws. But yeah, I think that's what makes it fun being a surgery resident. Like you're not only expanding on the brain, but your hands.
Yeah, and I think it's interesting that you say the random two-handed tie. I had an attending that wouldn't let me do one-handed ties until I was a 3. And to this day, I still will tie midline laparotomy fascial closures two-handed, because to me, I know it's the most secure way that I can close something. It's, if you ever had a dehiscence before, or heaven forbid an effusion, you always see sometimes you just see those knots came apart, and whatever I can do, and at least in my head, maybe it doesn't make a difference, to feel the most confident that's not going to open up, at least from not from a patient factor perspective or technical perspective, is to do that two-handed tie, even though it looks a lot cooler to do it one-handed.
I still do the same thing. The first couple are two hands, and then I'll one-hand it the rest of the way. Some other stuff I want to go over is gaining trust of your senior residents and your attendings. How do you guys feel about that? And then personally, what do you guys do?
preparedness, it all comes down to getting the finger on the pulse, so to speak, and knowing what's going on. If you walk into a case prepared, presumably the attending's going to have some sort of question for you, at least at my level of training, and you just start and build from there. And anticipation would be the second aspect of that. Knowing what the next step is. If some part of the case is lagging behind, getting that step up ready will show the attending that you're ready to take that next step. So I found that especially with certain attendings, that's made a really big difference.
I think one of the biggest things that attendings look for, especially in junior residents and specifically in interns, is the ability to rely on them, to be able to say, hey, I want this done, and then to know that person's going to do that. And I think trying to just be reliable, to be able to follow directions, and it really does go a long way. And I think beyond just being reliable, being affable, being available, sometimes being able is one thing. You may not be the most technically skilled, but showing that you are willing to take feedback and implement it, and especially with an attending who gives you that feedback, putting it into practice, and then showing them and asking them for direct feedback. I think a lot of people shy away from asking for direct feedback, but if that's one way to show your attendings, I'm listening, I'm trying to get better.
Agree with both of you. Nothing more to add. What's the biggest highlight of your year so far in terms of in residency, so thus far?
While Will takes a moment to digest.
I'm an intern. There's a lot of lows. You have to focus on the highs.
Big pause there.
Without giving away my circumstances, coming and I'll just say I came to this current program that I'm in late. I was at a different program, and I came to my current place as a transfer resident, and it kind of felt like being an intern all over again. I had been an intern. I had been through the ropes. I had thankfully been able to operate quite a bit where I was at, but when you come to a new place, you're starting from scratch. And I think the first time that my multiple attendings have handed me the knife and said go, I knew that I had gained their confidence and shown them that I was affable, able, and available and reliable. So I think that has been the most rewarding experience from this year. And then, we'll go with that. I think that's been the highlight of this year.
Yeah, I respect that a lot, and I don't want to take the low-hanging fruit of the, that first little skin case where you pull the cyst out and you did it. But I think there have been a couple times my overall answer is small victories. There have been a couple times where you come in, you're the one who sees the consult, you're the one who books the patient for the OR, you follow them into the case, you're the one who rounds on them, and then you're the one who writes the discharge summary. So it's happened a couple times. It's been great to see the flow from beginning to end, and of course, you've had a lot of support along the way, but being able to make some of those critical decisions, own those critical decisions, even if they're not correct, and roll with it, probably super rewarding.
Yeah, I remember my intern year, I think it was taking out my first gallbladder and appendix. It wasn't a skin-to-skin situation, but, my attending was like, all right, here, go ahead and, take this gallbladder off the liver bed, and I thought that was the coolest thing. I was probably week 2 as an intern, so I still remember it vividly. But yeah, it just builds. It'll definitely build for you too as well. What's the scariest moment of this year for you guys? Going from high to low.
I'm gonna give 2. Scariest moment, part 1, was moving, dropping everything that I had known and where I thought I was going to live for 5 years and potentially for the rest of my life, and moving someplace new, not knowing anybody. That was a scary thing to do. And I think the first time this year that I was the most senior resident during a trauma red, and my senior was in the operating room, it was me. And I had to quickly compartmentalize that, go through my ATLS protocol, and it all worked out well in the end. But that way more scary things happened intern year. Second year, not quite as scary, but that's probably the most puckering of the experiences.
All right, Will, he set you up.
I was gonna say I'm with you, Nick. There's a lot I would care to forget. I've had my fair share of close calls, buzzing the tower, so to speak. But on my critical care rotation, very first day, very first patient assigned, within 2 or 3 hours of being there, just familiarizing myself with the patient, rapid right into a code right off the bat, trying to and understanding my limitations and going back and forth. But sometimes I still kick myself for some of the decisions at the beginning, but it was all learning experience in the end.
Very good. Yeah, mine would probably be, I don't know if you guys remember that one trauma with the zone 1 penetrating injury, but that was nuts, where one of my chiefs and myself, we had to stick our hands literally over this patient's neck that was just essentially having pulsatile bleeding from the carotid. So that was quite scary, but also rewarding, because that guy was able to walk out of the hospital. So that was definitely my highlight and my low within one whale swoop. All right, guys, we're almost towards the end here. I know you guys have been getting sickle decubitus ulcers now.
It's just stage 1.
Just stage 1. I think this is a good one, and we'll spend some more time with this. What do you guys think is the biggest misconception of your job from those not in the field, and how do you make them understand?
Ooh, I got this right away. I think I'm gonna get on my soapbox for this one, Paul.
Go
sorry.
for it, man. No, that's fine.
We're kind of taught, especially in medicine, like it is a lifestyle. You have to live and breathe medicine. It follows you home from the hospital. And I know you guys have kind of talked about this at the beginning, where sometimes the pressure of the job and really caring for your patients, which is the ultimate, that's what brings us all here and why we're here.
Sure.
But sometimes that can go to the extreme, and it can follow you home. And when you're off the clock, it still occupies your thoughts. It can follow you. I'm here to say that there are those of us out here who don't let our job consume our life. It is a career, mind you, and it requires significant dedication, but there are a lot of things that we do off the clock, so to speak. We have lives, hobbies, interests outside of that. And I just really want to attack that classic stereotype of the general surgeon, of the stuffy old guy who's yelling that the room is too hot and barking out orders and that sort of thing. There's a lot more to it, and I understand that may be the time of old, but I want to embrace the new age philosophy of, surgeons are critical thinkers, very detail oriented. It's a very rewarding career, and it doesn't have to be your life in the sense that it follows you home. It is very much a profession that requires dedication. It requires 100% commitment and effort, but does not follow you home. You can have a wife, you can have children, you can have hobbies, you can travel. It is all in how you budget your time. We all have a finite amount of time. It's just how you choose to use it.
I'll just piggyback on that. It's not my answer, but I'll piggyback on that as somebody who their entire first year, it was their life. And I think part of that is why I was potentially as unhappy as I was, outside of the factors that I couldn't control. I think the factors that I could control, I wasn't doing well with. I was taking my work home. I was thinking about it constantly. I let the hobbies that I have kind of go to the wayside. I stopped being me, and I was basically just a resident. And I think over the last 7 to 9 months, whatever it's been, this year, getting away from that and trying to become a person as well, and trying to get back to just being Nick, not just Dr. Nick, has really been rewarding. What was the question again?
Yeah, I think I got us on a sidetrack.
Okay.
I'm sorry,
No,
Paul.
it's
I got
all
us
right.
rolling.
I like the passion. The question was essentially just, what's the biggest misconception you think that
No.
those not in our field, our profession, that they misconceive about our job, essentially?
That could go down a lot of rabbit holes. I'll just take something that's colloquial, especially amongst young people, is that general surgery residency is like Grey's Anatomy. It's a lot of people doing things at the hospital maybe they shouldn't, and then they get out of the hospital and they never, like Will said, they don't have a life outside of the hospital. It's just drama 24/7, and it's not real life. Also, general surgeons don't become neurosurgeons. They don't become orthopedic surgeons. That's something off that show that's not real. Just, that always drives me crazy. Great show, though. But
I can't bring myself to watch it, man. There's just too much.
I did it.
I can't.
I did it in undergrad. It was fine. But I think surgeons are people, and we're not these drama-happy, obsessed with work individual. And I think this just kind of plays off of what Will said. We're humans. We have lives. We don't spend 36 plus hours at the hospital. Not anymore. ACGME rule restrictions. And when we go to work to do our job. And that's really what we're there for. We're there for our patients. We're not there for any of the other shenanigans that are there for TV likes to dramatize. My family loves to compare me to one of the people on the show from a looks perspective, and they think that kind of dictates my entire life and personality, but it doesn't. We're humans.
Which person is that again?
That would be Dr. Hunt.
And what is his nickname?
Oh, he doesn't have
Oh,
one,
he
actually.
doesn't?
No.
Huh.
Mick Redhead, I don't know.
Maybe we should have one. We should make one for you.
I'll take one.
Yeah, I agree with you guys. I think it is becoming a changing of the guard almost. The old school surgeon spending 24/7, 365 at the hospital is fortunately dying, especially with the new age of acute care surgery and these surgicalist positions, and more emphasis on mental health. I think that's been nothing but good. But also, some of the old school thoughts and founding fathers will say also you don't get as much experience. But I think what a lot of my friends that are not in the field, what they forget is it as much as we have quote unquote free time, we carve that out, majority of our life is still at the hospital. We still miss birthdays, we miss weddings, we miss bachelor parties, bachelorette parties. So it still unfortunately consumes the majority of our life. And so I think when I'm discussing that with my other friends that are not in it, they're like, man, Paul, like, you don't ever have any free time, you never hang out. But it's always like that delayed gratification. Eventually we'll get there, and I think we will. Like I said, with all the changes going on in ACGME and mental health awareness, I think we'll get there. But it's still tough. It's still tough really to live that other life that the TV shows kind of portray. But I always tell them, like you said, once you come back to what you think is the main reason why you joined, or not joined, but rather got into medicine, to help others, to do something incredible, take out somebody's cancer, or fix somebody's perforated intestine, pretty much take them away from death's doorstep. I think when you start thinking of that, it doesn't matter how many hours you put in and how tired you feel when you see that person walk outside the hospital. That makes everything worth it. That's why they look up to you as a surgeon, and so I try to give both vantage points when I discuss that with my friends and family. It's hard. It really is hard to still make it to. Missed my, some of my nephew's birthdays because I was working. All right, guys. So we're coming up towards the end. I think unless you guys have anything else, the last question I want to ask you is really, what advice do you have for, say, a fourth-year med student to an intern, Will, Nick, what advice would you give to those coming in?
Certainly. And having a lot of friends who are also in medicine reaching out, what I've been telling them all is, you just take it one day at a time. You can control the things that you can control, and just move forward from there. This is a marathon, and there are going to be certain aspects there. As I mentioned, there's going to be lots of highs, lots of lows, but control the things you can by you show up every day, you show up on time, you show up prepared, and just keep yourself organized and lasered in. Everything else will just fall into place.
I'll touch on both. So I think the hardest part for the incoming intern class, who are medical students now, when you match, it's amazing, right? Life's never been better. You've reached the goal that you're looking for, but you have to realize that intern year, doesn't matter where you do it. It could be the worst program in the country, it could be the absolute best. Your intern year is going to be hard. It's going to be the year of firsts. It's going to be the first time you proclaim somebody as dead. It's going to be the first time maybe you've ever done this X surgery, this procedure, the first time you're scared to the point where you don't know how to function, and you're going to have to find a way to internalize that and move forward. But if you can find a group of people to help you get through that, hopefully co-residents, family, friends, you will get through it. And I think that's something to keep in mind. You will get through it. And then for the incoming twos who are about to wrap up their intern year, I think it's important to self-reflect and think where you were a year ago. Think where you were 6 months ago. See how much you've grown when you didn't realize how much you were. I think if you're on a different rotation, or one rotation at the beginning of your intern year and the end of your intern year, you'll realize how much you've matured and how much of a better doctor you've become in a short amount of time. And that exponential leap doesn't just stop after your intern year. I think back to this time last year, and it's a phenomenal difference. And I know that's going to continue going forward. So I think, as Paul said, remember why you went into it. Realize there's a light at the end of the tunnel. Residency is, it's 5 years, and then you have the rest of your life. So enjoy the 5 years the best you can, and find the little things to take happiness in. Put one foot in front of the other, and if you need help and you're struggling, ask for it. I didn't ask for it last year, and I wish I had.
Wow, these are very good answers, gentlemen. Everything is valid. I think that the only thing that I would add is, and it's partially my personality, and I'm sure it's just like y'all, managing expectations. I think that's huge.
Yes.
Absolutely.
Coming into year, I was like, I'm going to be the bee's knees. Like, I'm going to know everything about everyone. I'm going to manage the floor. I'm going to operate, and I'm going to see all the consults. Like, I was going to do everything. And that's just not humanly possible. And so, sure, give yourself the fire, the flame to continue to work and to stay motivated and to progress, obviously, but also to understand your limits. I think that was another thing. I got to several points, I think, my intern year where I got to the point of almost burnout. Yeah, it's going to happen, unfortunately, but realize it as you get older, like me now. Old man wisdom, but the same thing when I'm playing sports. It's like I can't run that 40 dash. I can't cut on a dime anymore. But my understanding of the game is better than it ever was, and so I realize when to go fast, when to go slow, and so just continue to realize that when it's a critical portion, go slow. When it's something super easy, go fast. But just manage your expectations, and I think you guys will all be fine. Well, that's all I got for you folks this evening. So really appreciate Will and Nick spending time out of their busy schedule, one more busy than the other. Nick's also on call for vascular, so I think you might be having a case coming in, so I don't want to keep him too late. But I appreciate you gentlemen for truly coming in and taking time to grace my microphone with your infinite wisdom. Go ahead, Will.
Yeah, thanks for having us on,
Yeah.
Paul. It was great to introspect and share a little talk with you.
My voice graces no microphone, but I think it's this platform really it sheds light on something that maybe is taboo. Is to talk about what it's actually like to be a resident. What the day-to-day expectations are, what we actually do, I think so much of residency is, to the outside population, is glamorized. You're a surgeon. Okay, well, what does that mean to be a surgeon? And I think maybe peeling back maybe the layers of the onion to really show what it is can maybe inform some people that want to go into it, people who are on the fence, didn't know if it was for them. And I'll just leave with one last comment. You don't have to be the alpha dog, raw surgery to be a surgeon. You know, you don't have to be exactly like the people that you see operating. You can be yourself, and that's okay. All people from all personalities and walks of life can be fantastic surgeons. You just need to figure out if it's for you. So I almost didn't go into surgery because I didn't know that I had the personality for it. Turns out I do. But, you know, if it's something you want to do, and maybe this is speaking more towards the younger audience here, give it a shot. And if it's not for you, walk away. But I think it's a pretty rewarding field.
Brilliant. Can't follow that up. Thank you everyone again for tuning in to the Sterile Room. Stay tuned for the next episode. That concludes this episode of the Sterile Room. Thank you for all the contributors, guest appearances, and of course, listeners. If you have any questions or concerns on the topic discussed on this episode, please feel free to reach out. And remember, folks, stay sterile.